Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning, good morning. What a beautiful morning. Good morning, Miss Ina.
Good morning.
Good morning, Anita.
Sorry I'm not in the studio with you, but my heart is there.
I know that. My heart is with you too, and Bill, and you've been on my prayers. Oops, there's Richard. Richard is in the house.
So let me ask you a question. You're laughing, and that's a healthy thing. How many people during this time when people are celebrating are not laughing, and they're anxious, and they're sad, and maybe depressed? What is it all about?
Well, it's very, very common to see throughout the area of the world where winter will settle in because of the darkness and the cold, to see many people that have a tendency to become depressed. And some people have what we call the seasonal depression. So they become depressed during this time, during the winter time. And believe it or not, anxiety also becomes a problem because especially if you live alone or just you and your loved one and you're going to have 20 people coming over, it's overwhelming. And I tell you, my sister, who is visiting from Germany, she came and her kids came and her grandkids and what have you. And it was a sudden visit. And for a moment, I was a little bit overwhelmed. I said, oh, my God, it's a lot of people in my office. And thank God that, we were just finishing surgery. So it was like toward the end of the surgery. So the waiting room was open. And they decided, no, we're just going to stay here in the parking lot. We just want to see Uncle Andy and say hi to him. And they were going to drive to Texas from here. Her husband, who is German, loved to come to the United States and travel all over. And they are very free floors. They don't restrict themselves. They enjoy their life. They both work hard, but they both enjoy themselves very, a lot. I love going to Germany to visit them, because they are always taking me out and doing this and doing that. So it was nice seeing them and spending just a few minutes with them. But a lot of people, when you have to entertain a large family like this, and you live by yourself or just with your loved one, it can become a very overwhelming situation, and people can become stressed out and anxious. And we should not hesitate to go and talk to your doctor and say, this is, and patients come to me. At least I'm very proud, I'm very happy of those patients that do come to me and say, I have so many people in my house, I can't sleep, I need help. And it's better to do that than to end up in an emergency room.
Huh. That's right. The emergency room, and you said this before, Dr. Mencia, you don't want to go to an emergency room if you don't have to.
Absolutely. And that's what prevention is all about, and right now, what you and Bill are going through, and both of you take good care of, of yourself and of each other. And, Bill is, 93, 94?
It's 93.
93 years old. And people need to understand that if your loved one is hitting into the 90s, it doesn't take much to turn your life into a completely different direction. When it comes to somebody like you, that you've been a gerontologist, you know a lot of what to do. But most people out there, they think, oh, if my father or my husband is in a rehabilitation center, And no matter how great the relaxation center is, how great they are, how great the staff, how well staffed they are, the loved one, the caregiver, need to be there with that person.
Yeah.
And I know it's overwhelming for you also, and I'm sure there are times that you go to a little depression that you snap out, and a little anxiety that then you snap out of it, and refocus and reorient yourself. And it's like flying a plane. You just have to find your bearings again and find it early.
Well, and there's when you have a lot of good friends, and they keep helping you and talking to you, and people like you, and people, who are there, it does help. But the thing is, you just said so well, advocacy is everything. And I know, for me, I'm a very busy person. When this happened, I just dropped everything, and it's amazing how just like you're so busy, we have a schedule, but when something's important, you just drop everything.
Absolutely. You have to focus and direct your service. You have to fly your plane.
Right. But Dr. Mencia, the interesting thing about all this is that you have always told people that they have to stay as healthy as they can because they want to avoid this. And yes, I think Bill's something he couldn't avoid because he's been very healthy, and I can't attribute it to anything else. But many people don't eat right, they don't exercise, they don't do things, and consequently they wind up with very serious illness, and then they do this to themselves.
And you have people that they put their head on the sand, and you say, well, you have not done your blood test. It had been 3 months, then 6 months, and they are in their 80s and 90, and they say, no, I want to wait for a year to do it. That's bad. That's really bad. That's no preventive medicine. And I'd say at the end of the day, it's your decision. We'll do whatever you think is right for you, but it's not my advice. My advice is get checked early, because I'd rather find a potassium that is a little bit high that I can fix, or a little bit low that I can fix, and not a potassium that's going to throw you into a heart condition, that's going to throw you into a loop of intensive care admission and what have you.
I mean, that they don't have potassium, is what you said.
Right. So, I saw a patient that was taking a water pill that tend to retain potassium, and the potassium was climbing. And she need to be on the water pill because it's the only thing that really keep her out of congestive heart failure. So, and she see a kidney doctor, and she see a cardiologist. And I told her, because of your kidney condition and because of the fact that you're taking this water pill, your potassium is climbing. So I'm going to have you see the dietitian so that you can take a renal diet, which is the diet that we give patients on dialysis, but usually it's very low in potassium. And we did that, and we repeated the potassium within a month, and everything got corrected without adding more medication.
Wow.
So, there are many things we can do when we know what's going on, but for that, we need to get our head out of the sand. And, there are people that they are very proactive in preventing depression and preventing anxiety and living a happy life. But there are people that, they come from up north. The shutters are up and they leave them up. The windows are closed. And, and what the listener need to do is just look around where you live now. Are your windows open? The sun coming out. Are you able to enjoy and see that? Or is your house like a cave? Well, depressing. So, open the window, open the door, go outside. You need to let the light in so that you won't become depressed. And I remember in New York City when I was training there, when we have patients that have seasonal depression, what we used to recommend is for them to get those large office lights to put in their apartments so that they have a lot of lights when they wake up in the morning. So that's
very smart. That's a good idea for a lot of your patients. I mean, good. So everyone should have a lot of light.
a lot of light to, especially you live in Florida. Here you have natural light, but you need to, get the shutter down. There's no more hurricane coming. Get that stuff out of the way. And open the curtain, open the window, go for a walk. Put on a jacket, please. It's cold today.
Well, let me go tell you, just to get some good applause to Regents Park of Boca Raton, where we are staying with the rehab center. This is a facility where it's surrounded by a lake, about patios, windows. I mean, and I see people in wheelchairs going outside, sitting around, and boy, talk about medicine. That's the best natural medicine.
Absolutely. And that's beautiful to be able to get the people, even the patient, have them to, sit them on a wheelchair and get them outside to get some fresh air and to let the light, hit the pupil and motivate them. So that's a very important therapy.
Well, let me tell everybody, of course, you're listening to Dr. Andy Mencia, and I'm Anita Finley, but I want to tell you about his splendid AGI Medical and Dental Centers. I mean, he talks a lot about a lot of things, but up there, you will feel so loved. You will feel so comforted. People are very kind there. It's not a typical medical office where you're just another number and they push you out. Everyone there has really caring ways, and if not, Dr. Mencia would not have them there. But let me give you a phone number. So it's Saturday today. And if you have a problem, it's going to be a long weekend. Go today. The phone number is 45. It's 954-489-46. That's in Fort Lauderdale, Commercial Boulevard. Are you open to Boynton Beach today, Dr. Mencia?
Okay. And I went to Boynton Beach this Wednesday, and it was great. It was a full house. And I have a patient that I've been seeing there since I started going to the Higgins Ranch office in Boynton Beach. And, those patients, they will come. But now we're like new patients, new faces. So I say, okay, this is great. This is growing. So God willing, 2017, I might be able to do two Wednesdays a month.
We have to get you a helicopter. We have to get you, everything else you need. But that's the problem of being too famous and too important. You can only spread yourself so thin, right?
Absolutely. And, I'm still looking into telemedicine to see if this is something that will help me help more people, not only in the South Florida area, but throughout the world, because people through telemedicine now, they can communicate with a doctor and get some advice on what to do and what not to do.
You're very good at that, because you're such a diagnostician. I think that we talk about that enough. You have such a natural way of looking at something, maybe unlike other people, other doctors, and you pretty much figure it out. Say, well, have you tried this or have you tried that? And in telemedicine, that could be very good because, as you said, someone could be in Spain or they could be in New York, wherever, and if they get you on the phone and you could ask them a few fast questions and you would pretty much know what's going on.
Absolutely, yes. And, I write an inspirational quote after I do my meditation. I write a quote for my staff. And one of the quotes that I wrote this week was that experience comes with repetition and time, but common sense is innate. We need to have common sense to be a good diagnostician and be able to, to take care of people.
Yeah, and I love what you said to me when I was, talking about Bill, and you said about in Hawaii, there are waves, and the waves, it's like surfing.
Exactly.
And the waves are high, and the waves are low. Well, I forget exactly how that went that you said.
Well, yeah, in Hawaii, we said that, to go surfing, you have to pick the wave at the right time, the right wave at the right time. So some of the wave might be too high, and you say, let it go by because I want something lower. And some of the wave might be great, perfect, but you just miss it, or so you have to have it at the right time.
Right.
For the listener, I know, if you cannot hear Anita, it's because she's on the phone. We are not both on the station. I love coming to the station, but we do apologize. But I'm very proud of what she's doing for Bill. Uh, for those people
Thank
that
you.
couldn't hear, I'm gonna go ahead and have Ina, my office manager, go ahead and give the phone number, because I think people couldn't hear the number. I just got a text. See this.
Oh, they couldn't. Well, I can do it again. Let me do it again and see if they can. It's 954-489. Did everyone hear that?
No, it broke. Let Ina give it
Okay.
because she's here
Okay,
on the
good.
studio.
Okay, go ahead.
The phone number to Fort Lauderdale office is 954-489-1345. And number to Boynton Beach office is 561-270-6494.
Hey, Ina, you're losing your Russian accent.
Yes.
Yeah, she's and that beautiful voice. She's had that sweet. People gonna come to see me just because.
Just
let me see
run.
that. Yeah, let me see that. Is it cold outside?
Oh, baby, it's cold outside.
Oh my God!
Maybe it's a good time since Ina's there. I didn't know that we ought to talk about Stonewater Med Spa.
And well, before we leave Ina, she has this admirer of her that brought her some flowers to the office, and she was so proud. Oh my God, she was so proud of her flowers. She put them in the front, and she didn't know where to put her flowers. And
Hey, Ina.
Yeah, that's one of my patients.
Oh, yeah, right. Here I am. I don't even you. Now you're doing all this stuff.
Yeah. That's a beautiful Christmas flowers. They're green and red and the colors. Very
Well, you
nice.
deserve it. You deserve
Thank
it,
you.
Ina. So tell me about Stonewater Med Spa.
the med spa is working very nice. This is our first month of running the med spa, and the season has been really busy. We have done a lot of marketing, internal marketing, I may say, and it's working beautifully. People are going there, and I tell them, when you go there, please give me some feedback on what can we do better. People are coming; they are very happy. The staff there, they are very dynamic, and they care for their customers. So they are very, very happy with the services. We have the salt bed therapy, which is like going to the Dead Sea,
Right.
and when you sit on that bed, you get this concentrated salt that not only help you with skin conditions like rashes and psoriasis, rosacea, all the mild skin condition, but also it helps you with the respiratory system because you are inhaling now this concentrated air with salt going through your sinuses. And I have one patient that went in, she's one of the rep, and she went and sat on the bed for 20 minutes. And she said, my sinuses were so wonderful, so no medication, just having this treatment that I took my daughter that suffered from asthma and sinus infection. And my daughter came out of there with being able to breathe and do those things. So when I hear the feedback like that, it's amazing. It's excellent. And
I'm
then
waiting to do that. That's going to be my first thing when I get free here. I want to do that. I want that salt bath.
I want to do it also. I'm so busy. I'm crazy busy, and my staff, Stonewater, they've been telling me to come and get your nails done. Come and get your hair done. I don't have time.
I know, but this other seems very medical. In fact, I was thinking that we were talking about maybe those people who are feeling depressed or sad, they need to go there for just one treatment, and just a facial or something nice like the salt, or just to relax.
Just
massage.
absolutely.
Massage too, right?
Absolutely. I mean, we need to take care of ourselves. And sometimes we think you pamper yourself and you're wasting your money. Sometimes you go and you pamper yourself, you're saving so much money because you are saving money on high blood pressure, on diabetes, on cholesterol, on hair transplant. I mean, you need to go and just relax yourself and give yourself in and let your body and your soul be caressed and bring you back into youth. Because aging, if you look at some of the monks that live in the mountain, they look so young. They look 20, 30 years younger, but they are very free. And then you look at the people that live in the big city, and they look older than their stated age. And that's because people that live stressing themselves, they possess property, or they have money, or they have business, and they live for the business. They don't live for themselves. And you have to always first live for yourself. And, you can take it to an extreme and just live a totally free life. I don't agree with that. Or you can bring it to the middle where you take care of yourself first. And the first thing I do when I wake up in the morning is take care of myself. And what is the first thing that you do when you wake up? Each one of us, we wake up in the morning.
I go to the bathroom.
We go to the bathroom, we brush our teeth, we wash our face, we comb our hair. It's innate on us to take care of ourselves. So, keep doing that. Don't just do it in the morning when you wake up, but keep doing it throughout the day. Put time aside. I put time aside sometimes when I'm working hard, and I just go up into my office and sit on my chair, and I do 5 minutes of meditation so I can continue to move on. And it's rewarding to me because then I can get out of the chair and I feel like a brand new man. I'm ready to go and continue to see patients. And one of my objective as a physician is to give as much attention, as much energy, and as much love to the first patient of the day as to the last patient of the day.
Well, I have to attest to what you do because so few doctors do this. You hug. You always hug someone, and some of these people haven't probably had a hug in years.
That is so true. That is so true. And people come and they get a hug from me, and I give them a kiss, and they say, I don't need anything else, Dr. Mencia.
Right.
I just needed a hug from you and that kiss because I know it's coming from your soul, from your heart. And, and, you don't get a lot of caregivers, physician caregivers that take the patient and look at the entire individual. I have a patient of mine that she comes and see me once a month. And she used to be a dancer. She used to dance with Frank Sinatra as a backup dancer for him. And I don't know the name of all of those singers from his age in the 50s and late 40s. And she come and she say, Dr. Mencia, I come here once a month, but I see you every night in my dreams.
Oh my. Beautiful.
Let me also give the dental. Let me also give the dental number to the Fort Lauderdale area because we are open today. It's 954-489-2517. That is the direct line to the dental office. We are open today, and if you are having any dental issues, and if you have insurance, remember today it will be your last date or utilizing the benefits of your dental insurance for 2016.
That's important.
Today is the last day. So if you don't use it today, then as of Tuesday, you start from square one for 2017 benefit. So if you don't lose those benefits for 2016, there will be drop off in all the dental insurances, and then you start again. So we will be open, and we start promptly at 8 o'clock, and we stay open until the last patient come in, which is our practice always for both the dental and the medical.
Well,
And we have the gynecologist
doing
today.
that. What?
Anita, we have a gynecologist today.
Oh
The
my God.
gynecologist joined our
Yes.
practice about a month ago, and she will be
Yes.
seeing patients today. And
I
as of
heard
next
that.
week,
I'm gonna go and get my gynecological exam.
Yeah.
and as of Anita, as of next week, we're gonna have endocrinologist joining our practice.
Really?
Yes.
Endocrinologist. Well, let me tell you, I did hear the show. I listened on YouTube to the gynecologist. She is fantastic.
She is great. She is great.
Patients loves her.
And the patients love it. That's what it takes for me. Show me the patient. Tell me that they love you. You are my consultant.
That's right.
And the endocrinologist is for those patients that have thyroid issue, that have diabetes, or any endocrinological condition that you need to see one. Well, we have one starting next Saturday,
Tuesday
and then you have a neurologist starting
on Saturday.
on Saturday also. The month. So 2017, we are kicking it off with bam boom.
Yes.
Well, Anita, it's been a pleasure.
thank you
Rachel
very
is
much.
giving me
I
this.
loved
Rachel is giving me
A
the
finger,
look.
a finger.
Rachel is giving me the look. You know, that look with the mustache.
I know.
It's been a pleasure to our listener. To our listener,
Happy
thank
New
you.
Year, right?
Happy New Year. To
Happy
our
New Year.
Happy Hanukkah. To our listener, I want to thank you because some of you have been coming to my office and telling me that bills have been on your prayers, and you guys have touched my heart. I love you so much for what you guys are doing, and for loving Anita and me and our loved one. So thank you so much.
Thank you. Okay, and I'll talk to you in 2017.
Okay, love you.
All right. Love you. Bye.
Bye.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.